Welcome back, everyone, to our third deep dive into all things X-ray. It seems like every week there's just a ton of news about X-rays in the headlines.
It really does.
We've got new technology, FDA clearances, new facilities opening up, and even some stories about some pretty unique uses for X-ray technology that I would have never thought of.
Yeah, it's pretty remarkable how diverse the applications are becoming.
Absolutely. So let's jump right into it. First up, we've got some great news for people with diabetes. The FDA just gave the green light to Abbott's FreeStyle Libre 2 and 3 continuous glucose monitoring systems, the CGMs.
That's right.
For use during imaging tests. Now, this is a big deal because in the past, patients would have to remove those sensors for X-rays, CT scans, MRIs, all that stuff.
Yeah, that's right. It was a major inconvenience and not ideal for tracking their glucose levels. So this is a big step forward in terms of, patient comfort and just making sure that they're getting the data they need continuously.
I mean, imagine having to constantly take off and put back on your sensor. That would be a pain.
Oh, absolutely. And could potentially disrupt the readings as well. This clearance means patients can just keep those sensors in place and, get uninterrupted glucose readings throughout those imaging procedures.
Okay, so this is great news. I just want to make sure we emphasize this. It's still super important for patients to tell their healthcare providers about any devices they have, before they go in for any imaging.
100%. Yeah, patient safety is always the top priority, and healthcare professionals need to know about any devices so they can take the proper precautions and make sure that the imaging process is both safe and effective. They need all the information.
All right, so moving on. Now we're going to head down south to Laredo, Texas. There's a pretty impressive new facility there. The Laredo Medical Center just opened up a brand new women's imaging center.
Oh, wow. That's fantastic news. Access to women's healthcare services has been a challenge in that area. So this is a significant investment in the community.
For sure. It's a $2 million facility, and they've really outfitted it with some top-notch technology, all aimed at providing really comprehensive care for women in that region. So can you give us a little rundown of what kind of tech they're talking about?
Yeah, absolutely. So they've got advanced mammography machines, 3D imaging. That's really the standard of care these days. They've also got bone density scanners, ultrasound equipment, really a full suite of diagnostic and screening services.
So basically, women in Laredo now have access to this whole range of care without having to travel long distances. That's incredible.
Exactly. Having these services close to home can make a world of difference, especially for, preventative care and early detection.
Okay, so we've talked about better access to care, but what about some truly cutting-edge technology? This next story is really interesting. There's this Australian company, MicroX, and they just landed a U.S. government contract for a portable full-body CT scanner.
Wow, portable CT. That's remarkable. Traditional CT scanners, those are massive machines. So a portable version opens up all sorts of possibilities.
Yeah, exactly. It's designed for situations where, a traditional scanner just wouldn't be feasible. So what do we think? What kind of applications are we talking about here?
Well, you could use it in disaster relief. Imagine a medical team needs to assess injuries quickly, in a really challenging environment. Or maybe military field hospitals, they need imaging capabilities. And of course, you've got remote communities where it's difficult to install large equipment. This kind of portable technology really changes the game.
It sounds like it. And the fact that the U.S. government signed a contract for up to $25 million, that tells you something about how seriously they're taking this technology.
Absolutely. That's a huge investment and a clear indicator of the potential impact of portable imaging. This is really going to revolutionize healthcare delivery, especially in those hard-to-reach areas.
Okay, now for a story that really shows how X-rays are being used in ways that, honestly, I wouldn't have imagined, the coroner in Greene County, Missouri, is now using postmortem X-rays in some cases. And the reason, autopsies are expensive, so this is a way to save some money.
That's interesting. I have heard of this being done in a few places, especially smaller counties where budgets are tight. But of course, full autopsies are still the gold standard in many cases.
Right, of course.
But X-rays, they can provide some really useful information in cases where the cause of death is, pretty apparent.
So if someone died from a gunshot wound or maybe a car accident, the X-rays could confirm that.
Exactly. It can help, confirm those findings, provide documentation, and even help determine that preliminary cause of death more quickly.
which I imagine can be important for families, who are waiting for answers, and also, from a legal standpoint.
Absolutely. So while it's not a replacement for a full autopsy in every case, it's definitely a valuable tool in certain situations, especially for a coroner's office that might be operating with limited resources.
All right, so we've talked about how X-rays are being used in unexpected places, but let's not forget about the folks who are just starting out in healthcare, the future medical professionals. St. John's University in New York, they just opened this incredible health sciences center, really state-of-the-art. And of course, you guessed it, X-ray technology is playing a major role in how they're training these students.
Oh, that's wonderful to hear. Incorporating new technology into medical education, it's so crucial. What are they doing at St. John's?
They've set up these advanced simulation labs, and the students can practice using X-ray equipment on, get this, lifelike mannequins. I mean, apparently these mannequins are incredibly realistic.
Wow. That's impressive. Mannequin technology has come a long way.
It really has. They can, they breathe, they blink, even sweat. It's wild. So the students get this really immersive experience. They can practice their skills, build confidence in a safe environment, and it helps to really prepare them for what it's actually going to be like to work with real patients.
That's a fantastic way to bridge the gap between, the classroom and the real world. And it's not just about technical skills either, right? I mean, these simulations help with critical thinking. They encourage teamwork. These are all essential skills for success in healthcare. So I think it's a fantastic investment by St. John's University.
Okay, now, for a story that's, it's a little bit on the unsettling side, but it's also a really important reminder about food safety.
Yeah.
There was a case recently where a doctor's X-ray image showed that a patient was heavily infested with tapeworm eggs, and the culprit, undercooked pork.
Oh, wow. That's a pretty dramatic illustration of the risks of, not handling and cooking food properly. This highlights the dangers of cysticercosis. It's a condition that happens when you ingest tapeworm eggs, and they hatch into larvae, and then they form these cysts throughout the body.
In this particular case, the cysts were found during a routine hip X-ray. So it wasn't even like they were looking for that.
Yeah, it was an incidental finding. And luckily in this instance, those cysts weren't causing any immediate life-threatening issues, but it could have been much worse, right?
Absolutely.
If those cysts had spread to the brain, it could have led to some really serious neurological problems, seizures, headaches, even cognitive impairment. So this is a very serious condition.
So the takeaway here is cook your pork thoroughly. Make sure it's cooked all the way through.
Yes, exactly. Proper food handling, cooking your food to the right temperature. These are simple steps, but they are absolutely crucial for preventing cysticercosis, which, as we've seen, can be a very serious health issue.
So this week's X-ray news has really taken us from, these amazing advancements to some really important public health messages.
It just highlights the incredible impact this technology has, right, and the ways that it affects every aspect of healthcare and even beyond.
Absolutely. It really is. It's remarkable how X-ray technology has, evolved from just this way to see inside the body to something that's really impacting so many different parts of healthcare.
It really is. It's fascinating to see, how something that started as just a way to see bones is now used in, emergency rooms, operating rooms, and even in, research labs.
And the pace of innovation is incredible. Like that portable CT scanner we were talking about. I mean, the ability to bring that level of imaging power to, remote areas, disaster zones, that has the potential to really save lives.
Yeah. Oh, absolutely. I mean, it's a huge step forward in terms of accessibility. Imagine being able to diagnose and treat injuries in like a remote village without having to, transport patients over long distances. Or think about the impact it could have after a natural disaster, when infrastructure is damaged and access to hospitals is limited.
It seems like it would be a total game changer in those situations.
Yeah, exactly.
And it's not just about the technology itself, It's about how it's used. Like that story about the coroner using postmortem X-rays, that was a good example of that.
That's right. It really highlights how even in a field as sensitive as, death investigations, technology can play a role in, streamlining processes, managing resources effectively. And, of course, there will always be cases where a full autopsy is necessary. But in certain situations, X-rays can provide enough information to determine a cause of death without the need for a more invasive procedure.
Right. It's all about finding that right balance between accuracy and efficiency. And speaking of efficiency, those training simulations at St. John's University, they sound incredibly impressive.
They really are. It's remarkable how realistic those mannequins are. They can breathe, they blink, they even sweat. I mean, it creates such an immersive learning experience for the students. It allows them to, practice their skills and build their confidence in a safe environment.
It seems like the perfect way to bridge that gap between textbook learning and real-world experience.
Exactly. And it's not just about technical skills. These simulations help them develop their critical thinking abilities, their teamwork skills. These are all essential for, being successful in any healthcare setting.
And then we have that stark reminder about food safety. I have to admit, the thought of someone being infested with tapeworm eggs it's pretty unsettling.
It's definitely not a pleasant topic, but it's an important one to address. Cysticercosis is a serious condition, but it's completely preventable with, proper food handling and cooking practices.
It just goes to show you that even in today's world where we have, such advanced medical technology, we can't overlook the basics. Hygiene and food safety, those things still matter.
Absolutely. They're foundational. No matter how sophisticated our medical tools become, preventing illness in the first place is always, always the best approach.
So this week we covered a lot of ground, from life-saving innovations to those important public health messages. X-ray technology really does continue to have this this really profound impact on all our lives.
It's true. It's a field that's constantly evolving, and as we've seen this week, the potential applications for X-rays, they extend far beyond just the traditional medical setting.
And with each new development, we're gaining a deeper understanding of how this incredible technology can be used to, improve healthcare, enhance education, and, ultimately make our lives safer and healthier.
Yeah, I think it's an exciting time to be following the advancements in X-ray technology. Who knows what breakthroughs and innovations await us in the coming years.
It really is amazing to think about how far X-rays have come.
Yeah.
From this groundbreaking discovery to something that's really a part of so many aspects of our lives now.
Oh, for sure. It's a real testament to human ingenuity and this, drive to keep pushing forward. From those early images, the ones that were pretty blurry to the sophisticated 3D scans we have today. I mean, it's been a remarkable journey.
And the pace of innovation just keeps accelerating.
Yeah.
It makes you wonder, what's next? What does the future hold for X-ray technology?
Well, maybe we'll see scanners that are even more portable, more versatile, making healthcare even more accessible, especially in those remote areas or places that haven't had, the best access to care in the past.
That would be incredible. Or maybe, we'll develop completely new imaging techniques that allow us to see the body in even greater detail, leading to earlier diagnoses, more accurate diagnoses, things like that.
Right. And who knows, maybe we'll even, discover applications that go way beyond medicine. I mean, X-rays are already being used in, security, art conservation, even archaeology.
It's true. It seems like the possibilities are really limitless.
As long as we, keep asking questions, keep experimenting, and keep pushing the boundaries, I think X-rays will continue to shape our world in all these, these fascinating and really profound ways.
Well, that brings us to the end of another deep dive into the world of X-rays.
It's been a pleasure, as always.
We hope you've enjoyed this look at the, all the latest X-ray news and insights. And, remember to stay curious, stay informed, and most importantly,
cook that pork thoroughly.
We'll see you back here next week for another fascinating exploration of the world of X-rays.